March is Colon Cancer Awareness Month. According to the American Cancer Society, it is one of the 5 most common cancers. It's mostly associated with those 60 or older, but the fact is more young adults are being diagnosed these days. So let's talk about it with radiation oncologist Dr. Scot Ackerman from the Ackerman Cancer Center back here on the morning show. So why are we finding it more in younger people, the group 20 to 49?
Well, colon cancer and rectal cancer are diagnosed through colonoscopy frequently. And that's how we do screening, and that's how it's prevented. And we don't recommend screening routinely for people under the age of 50. So while we've seen the incidence of colorectal cancer drop in those over the age of 50, it's still significant, but the incidence has dropped over the past 20 years, we haven't seen that same drop in younger people. And the postulate is that younger people, ages 30 to 50, aren't having screening done because we don't recommend it, number one. And they may not have access to care as older people do because there's a higher incidence of uninsured people who are in the younger age group. People between 30 and 50 are less insured than people that are older. And perhaps they're also not in tune with their bodies, and they're not in tune with signs and symptoms of colon cancer that would bring them to see the physician.
Is it time to change the screening guidelines?
No, because the incidence, although it's going up in that group, is still rather small and significantly lower than it is in the older age group. So the screening wouldn't have that much impact on decreasing the incidence of cancer in those people or the diagnosis of it earlier.
All right, if you're not getting screening, what are some of the things that cue you to the fact that you've got a problem? I know family history is big.
Well, family history is important to know because that way you know if you have any signs and symptoms that it really would be more important. But the signs and symptoms of colorectal cancer are changes in bowel habits, narrowing of stool. If it's more difficult to have a bowel movement, your stools are thinner caliber, that's a concern. Any bleeding, any rectal bleeding, usually if it's bright red blood, that's in the rectum, it's usually associated with hemorrhoids, but darker stool, a bloody stool is a very common sign of, is one of the more frequent signs of someone who has colon cancer. So change in bowel habits, abdominal distress, narrowing of stool, and rectal bleeding.
Now, you mentioned, for a lot of the younger people, they don't have insurance, but the fact of the matter is that insurance, for those who do have it, will cover most of the colon cancer screenings, so you're not out of pocket anything. It's one of those routine exams that they suggest you get.
Exactly. So about a decade ago or so, it's been mandated that colon cancer screening is part of any health insurance. And certainly in Florida it was mandated, I think, about 10 or 15 years ago. But now with Affordable Care Act, it's part of it as well. The U.S. Preventive Services Task Force has made recommendations for all sorts of screenings, and colon cancer screening, which we'll talk about in a second if you'd like, is mandated to be part of any health plan. And colon cancer screening isn't just colonoscopy. That's my preference when I talk to my patients, because the colonoscopy examines the whole colon, and that can find precancerous polyps, remove them before they become cancerous. But also it's very appropriate to do sigmoidoscopy, which just looks at the lower part of the colon, or a fecal occult blood test to look for blood in the stool. Those are also considered screenings, but the best and most thorough screening is the full colonoscopy.
So the bottom line is that you should probably get the test, certainly if you're over 60, because the earlier you get the test, if there's a problem, they can take care of it. Dr.
Absolutely.
Ackerman, always a pleasure. Thank you.
Thank you.
Jen.